Let me kick off first with karakia. Karakia te makatanga koutou. Me mahi tahi mātou, ka kōrero, ka whakarongo, kia atawhai, kia manaki mō ngā whānau, mino hapori katoa. Kia rātou te tino rangatiratanga e o rātou hauora. Kia pai te taha tinana, te taha wairua, te taha whānau, me te taha hingari hoki, humi e hui e, tae ki e. Kia ora. So kia ora everyone, ko tangata tariti ahau no Aotearoa ahau, ko Coral toko ingoa. So greetings everyone, my name's Coral. I'm a passionate tauiwi non-Māori who is my role at Collaborative Aotearoa is Strategic Project Manager and Change Lead, and I'm based here in Aotearoa, Christchurch. So I'd like to take this opportunity to warmly welcome all of you to this Collaborative Aotearoa webinar with a basis on resilience and readiness for practice continuity lessons from disruptive events. Before we kick off and introduce our wonderful speakers for today, just want to also reach out and say thank you to Heather Ling from Pinnacle Midlands Health Network, who suggested we lean into this topic for this webinar. So we're going to be hearing from people within the sector who've had navigated the challenges of disruptive events in Aotearoa, and the key thing around that is being able to share experiences and practical strategies from navigating what these examples are of natural disasters, but which can be picked up and utilised in all disruptive events. So throughout our session, we're going to have the Q&A button is open to the audience. So I do encourage you to place your questions in there. We will dedicate the final part of the session to Q&A and any themes identified during this kōrero. So it's my absolute pleasure to welcome the panel. So we're joined by Michelle Tekera. Michelle's of Ngāti Porou descent. She's been a dedicated advocate for equitable healthcare since 2005. She's the General Manager of Three Rivers Medical in Gisborne, which is a practice serving just over 20,000 patients. And as you'll hear, she's deeply engaged in addressing the needs of high needs and the Māori population. Kia ora, Michelle. We've also got Angela Blunt. She grew up in the Hutt Valley and studied law down in Otago. And after graduating, she practiced law in both Aotearoa and London before purchasing the family farm in Kaikoura in the late 90s, where she has, with her husband, raised 4 children. So for her role, she's the Health Services Manager for Kaikoura Health Te Aotearoa, and she holds responsibility for managing both the privately owned general practice and also the facility admin, cleaning, kitchen and maintenance teams for Te Whatu Ora Health New Zealand. And she's a key member of the Kaikoura Emergency Response Team. And finally, we've got Martin Carroll. So Martin is Te Waipounamu Regional Business Continuity Manager for Te Whatu Ora Health New Zealand, and that's a role that supports and promotes building resilience within the community-based healthcare providers so that they are more emergency ready with good business continuity plans in place. So Martin is passionate about primary care and community-based healthcare delivery, knowing that this is a key point of connection for all of our communities and our people across Aotearoa. Whew, what a lineup. So I'd like to invite each of the panelists to spend up to 10 minutes to share with us all about your experience and what has led you to be on this panel, having navigated some natural disaster, and the key lessons learned. So we want to get some of that gold dust that people will be listening and going, oh yeah, I just have not thought about that. So we're really keen to understand your experiences both within the event and the immediate aftermath, but also some of those post-event reflections that you've made and what things you may have put in place because of what you've gone through. So we're going to begin with you, Michelle, and then after 10 minutes, or we could start with Angela, whichever one you like. Angela, I know you've got some fabulous slides of some pictures. We'll kick off with that.
Pictures.
Let's start off with Angela, and then we'll go to Michelle. Beautiful. All right, over to you. Kia ora.
Kia ora koutou. As Coral said, I'm Angela Blunt, Health Services Manager in Kaikoura. So on the night of our earthquake on the 14th of November 2016, at 11:45 I woke up and looked at my phone to see what time it was and realised the power was off and thought, that's a bit odd. I'll ring, we live out in the country, I'll ring main power and get our power back on before the morning when I've got to get everyone out for school. And phone was not working either, the landline phone. And I thought, oh, hell, that's a bit strange. Something must be really going wrong. And the next thing, I was thrown across the room and the earthquake began. And my first thought was for my whānau. And I think that's something that you all need to be prepared for, is that your first thoughts will be to look after your families. And so having a good plan at home so that you know your family are safe means that if you have to go into work, you can go into work and do what you need to do, knowing that everything's okay with your whānau. There's no way to prepare for an event like this except to prepare. And you can't over-prepare or under-prepare, but you just need to think about what might happen in an event that you have a disaster. Don't do it on your own. Make sure you do it as a team, because the gold comes from, as Coral referred to it, comes from the members of the team who see things that you don't see, who hear things you don't hear. One of the first things that I've now thought about in my planning and our planning as a team is how we get in. I live in the country, our nurse manager's in the country, I live behind 3 rivers. So in the event of a disaster, after our earthquake, I couldn't cross our river, it came up. It was nothing, and I ford it, so I don't have a bridge. And so it was nothing when I came home that night, but when I went to go down to the river at 2 o'clock in the morning, it was an orange pea soup that I couldn't cross. My husband was away, and so I wasn't going anywhere until the morning. By the morning, thankfully, it had gone down, but it led me and Emma, our nurse manager, to think about, in the event that something happened now, how do we get in? How do we get in to support the team? And so making plans around that. Is it a local helicopter company? Is it a friend? Is it your husband in the tractor taking you across so you can get out? Do you have a vehicle on the other side? They're really small things, but they're really simple things. How will we get staff in? If you've got staff, for us rurally, lots of staff live rurally. So how will you get them in? What will you do until you can get them in? What do we need for every scenario? Fire, flood, earthquake. You know, for us, it's generator. We were lucky. We had the generator, and I'm getting to share my slides. So that's Aotearoa Point, the first slide there, and that was completely blocked. And then further down, that's the further down the coast. So we were locked in for over a month before the roads were cleared. And this is on the night of the earthquake. So we had a generator. So we were the only place in town that had power and lights. So the lights around the building that you can see on the slide were powered by our generator. So everybody came up to us because A, we're a high ground, so above tsunami. B, we had power, so they could see lights and they felt safe where there was lights. And C, they discovered that we had public Wi-Fi, and so everybody wanted their whānau to know that they were okay, so they hooked onto our Wi-Fi. That was something we hadn't prepared for. The other thing we hadn't prepared for is we've got great big water tanks that provide water to our facility, and there are taps on the exterior of the building. So people were filling up their water bottles from our water supply. So we had to remove the tap handles to stop that happening so that we had water in the facility. Then did we have water for our staff to drink? Lesson learned, we've got a pallet of water that gets changed over as often as we need to, so that we've got drinking water available in the event that there's no drinking water. We've got boxes with, and we had them before, with paper for notes, prescription pads, controlled drug pads. But we thought the other day about what happened. We had a fire alarm. There wasn't a fire, thankfully, but and we thought about what would happen if we had a fire and we lost any of those things, those boxes. And so we've got an off-site box now, so that in the event of a fire, we've got something off-site. So have you got your emergency contact list for all your staff? so at hand, at home, because emergencies don't just happen while you're at work. So make sure you've got a plan, a copy of your business continuity plan and your emergency response plan at home. I don't think anybody had any of those, and I wasn't the practice manager at the time. The practice manager at the time lived at Aotearoa, and she was unable to get in until about day 2 or 3 when they flew her in because she was blocked in between 2 slips. These are my sort of top 10 tips. Comms plan. What if you've got no communications, no ability to call anybody? We had no cell phones for 4 days before Spark and Vodafone fixed their towers in town, and certainly there was no comms outside of town. How do you communicate if you haven't got that? Have you got Starlink at home, or are you on an internet provider that will continue? If you plug your generator in, you're on a satellite system so you can actually access it. You never know everything that's going to happen, so you can't be prepared for everything. As I said, we weren't prepared for the 1,000 people that turned up on the night of the earthquake to connect to the Wi-Fi, to seek security, to block our roads so there was no way that we could get patients in and out, to, you know, all of those things. The picture there is a picture of the helicopter. The helipad is just opposite the building, and we had a helicopter there at all times because obviously no roads, so no ambulances. But you can see this is day 3 and there's still loads of people hanging around using the Wi-Fi. The marae were amazing. They're just behind us and they fed everybody, all the tourists. There were over 800 tourists in town at the time. This is what our emergency operations centre looked like, and there were lots of these things that happened during the day where we managed what was going on and we were prepared for that. Having a good whiteboard is an essential tool, and having several of them, large ones, makes life a lot easier. All of the, you know, getting to work was hard. Those are photos of getting to work. So the other thing you need to think about is if you're having staff in, have you got bottled water? Have you got food to feed the staff? Because obviously there was no food available around us, and we were lucky that the Army and the Navy flew and brought food into us. But yeah, being prepared, having, you know, a few tins of soup in the staff room and things like that, that just mean that in the event that you're stuck, you've got something to give everyone. One of the things that we learnt was making sure that we had query builds for our vulnerable patient lists, so that in the event of an emergency, we knew who all our patients were who were on home oxygen or who were vulnerable. We had lists of our patients over 85, so that they were visited or contact was made with them, particularly those living alone. So I've now got in our PMS, I now have query builds saved so that in the event of an emergency, I can log in. We're now on, you know, in the cloud, so I can log in and I can upload and download those spreadsheets, so that then our district nurses and our nursing team and our medical team can make contact, and our health coach and HIP and all of those people. It's really important that you know, because patients who are on home dialysis or home oxygen, if the power goes out and they don't have a generator, you need to be able to provide some support to them. One of the things that we all learnt in Kaikoura was the importance of connecting to our PHO's emergency response management team and recovery team. Those connections helping you to build your plans are fantastic. They've thought about those things in a way that we hadn't. For rural practices, connect with your councils. I'm a member of our local emergency response group, and that includes fire, police, Red Cross, Māori Wardens, Runanga Council, St John, all of the organisations that are involved. Make sure that you connect with them and that you connect with your council if you're rural, so that in the event of an emergency, one of the things that we needed was fuel for cars, and fuel was rationed, so for the community, but we were able to get fuel because we were providing health services. We're now part of the fuel plan for an emergency that the council holds. So things like that are important for running the practice, keeping things going, are absolutely vital. The biggest learning that I had is that while foundation standards requires us to have an emergency response and a business continuity plan, you shouldn't be planning just for foundation standards. You should be planning for what happens in the real world. And we have to do an annual clinical scenario as part of foundation standards. I'd suggest adding an annual emergency scenario to your annual plan for the year of what you do as a team, because we do that. And it's amazing what comes up that you'd never thought of for the scenarios that we've run. It's a huge part of developing the team that's going to manage in an emergency as well. It also makes the whole team aware of what they need to know, because I can tell you now, most of your team won't read the business continuity plan or the emergency response plan unless that's something that floats their boat. So if you've got them thinking about what you've already got in the plan because you're doing these scenarios and looking at your plan as you go, it really helps in the event of an emergency, because as I said at the beginning, you can't prepare for everything, and the best way to prepare is to prepare as much as you can. When you have prepared well enough, you've got your team into a mindset that helps them then in an emergency to think outside the box, to find the solutions that you need. That's really all I have to say. Thinking about your business continuity plan, if you think in terms of the impact of each event and how it might affect you, that really helps in your analysis rather than just following a template. Thank you.
Beautiful. Thanks, Angela. Gosh, it's yeah, those pictures are quite outstanding, aren't they, in terms of the impact to the natural environment and the impact of those blockages. I've been busy scribbling down some key gems as we've been going along, so we'll be able to share some stuff after the webinar on that. Beautiful. All right, so it's my pleasure now to hand over to Michelle. Kia ora.
Kia ora everyone, ko Michelle Aotearoa, General Manager of Three Rivers Medical in Turanganui, Aotearoa. Angela's basically said a lot of what I was going to say, so I think from a, and she had pretty pictures, well not pretty pictures, I did have some pictures but didn't quite finish it, but I'm sure you're all aware of the images from television, the impact of Cyclone Gabrielle, and to put it in perspective, if people are old enough will know and remember Cyclone Bowler, Gabrielle was worse. So I only moved to Turanganui, Aotearoa 4 years ago, and it was my very first experience of a natural disaster. In Auckland, yes, we got flooded and might have had a little tornado here and there, but I have never been personally affected, never had to deal with the impact it had on my team and the community and my whānau. So for us, the cyclone was the 13th of Feb 2023. Unfortunately for us in 2022, we'd had, I think we counted 5 severe weather events. So leading up to Gabrielle, I'm going to be quite honest, I think we were a bit blasé about the weather warnings. So the biggest lesson we've learnt is never ever take a weather warning for granted or any emergency announcement for granted, because we were caught out, and I will be honest, by not being prepared, as Angela has said. So yes, we had our business continuity plan. Yes, it's part of foundation, but on the day we went to look for it, we could not find our hard copy business continuity plan. So that is, I did actually have one at home, and the night of the cyclone, we thank COVID, and it's our saving grace was our preparedness and all our emergency lists for the COVID pandemic. I actually had those at home. So when I knew the cyclone was real, and I found that out by opening my kitchen door, and it honestly sounded like a freight train was running past. Also learnt which way winds blow, because I don't know what a southeasterly or a southwesterly is. I thought they went one direction, they didn't. So I moved all my furniture, outdoor furniture, barbecues and everything to one side of the property. It was the wrong side. I knew that when the cyclone started picking up, when everything was smashing against the side of the house. But I had staff lose everything. Their houses were wiped out. We have staff like Angela living in rural areas up the coast. Some of them take over an hour and a half to get to work. We have people in Mahia, Tikaraka, and I think you all would have heard the awful stories of the people in Tikaraka, small community, 40 minutes out of Gisborne, where they basically sat on top of a hill not knowing anything for 12 hours. And that whānau and a lot of my staff lost everything, right down to they didn't have a pair of shoes. So the preparedness side of things, I managed to ring as many staff as I could. My power went out at home at 8 o'clock at night, and then I had no contact with anyone. The next day, basically, I didn't know what to do. We had no comms, no power, no water, nothing. So my first thing was get to work. I was at home with my partner and my cat. They were safe, so I knew I could leave home, get to work. And luckily, staff from COVID knew the thing was just to come into work, and that's where we established who we hadn't had contact with and who we needed to try and get contact with. We were caught out also. I've never not had comms, telecommunications, so no internet or phones. I was halfway through doing payroll. So we were caught out on site with petty cash as one little tip, I would say. Always have a big amount of petty cash hidden somewhere on site, because a lot of our staff live paycheck to paycheck, and we did not have access to money for 9 days. They did fly ATMs in, and the queue, I think, it was about 4 hours to queue up, and you're only allowed to get $50 out at a time. Angela mentioned diesel. Our generator was half full, so it lasted for a bit and then it went out. So that's another lesson learnt. We now check it monthly, as our business continuity plan advises us to do. And we also have diesel and water stored off-site in 3 locations, because to get to our practice, there's 3 bridges, hence the name 3 Rivers Medical. 2 of those bridges were fully cut off for many days, and we didn't actually get contact with a lot of staff for nearly a week, some of them who lived way out. The list of vulnerable patients caught us out too, because we have long-term condition nurses in the community. Because we didn't print those lists on the Monday when we lost everything, we didn't have those lists. It was just lucky that they were able to kind of remember their patient list. So we now have a query build as well, like Angela, that we can actually run those reports and go and check in on our vulnerable patients and whānau in the home. We covered the rest homes, so it was a matter of, I was lucky enough that my nurse practitioners were able to get to work. And sorry, just going backwards a bit, we split the team like we did in COVID. So we did half and half. Anyone with children, anyone who's worried about their whānau at home, we did not expect them to come to work. So very similar experiences to Angela. We were opened up to Aotearoa. Our GP liaison was fantastic. She was in here from day one. Our PHO managed to get to us in day 3. From there, our GP liaison made sure we were part of the Civil Defence Emergency Planning team. So we had updates every single morning. And then amongst all the other 5 practices, plus Te Whataora, plus the PHO, Civil Defence, we had good lines of communication. And when some of us got power back on and some comms, we were able to have daily updates. But our GP liaison would be at those emergencies and then come to us and report back daily on updates. We used our local radio station. He was amazing, Bevan at just down the road. So basically anything that changed for us, so our comms was write notes. I'd send my projects manager, she'd sprint down the road, chuck it under the door, and that's how we communicated. So transistor radios are a must. I haven't seen one since the 80s, maybe even earlier. So a lot of us now have transistor radios. And that preparedness at home, I didn't have batteries for my torch. Luckily, my partner still smokes, so I had a lighter where we could light the candles. So just all those things. And I think probably if I've got a few more minutes to touch on the stuff afterwards, so the impact is still prevalent today. It's still prevalent amongst staff when it rains. If there's a windy day, we get weather warnings. We now send everyone home early. The impact on the staff straight after Gabrielle was huge, and a lot of them could not work for a long time. So as business owners, if anyone's business owners, being prepared to actually pay your staff full wages during that period. We didn't charge any patients, and we worried about that later, and dealing with insurance claims, etc. And I will bring up insurance companies. They were a nightmare. That was like another natural disaster for us to deal with, to try and claw back and get any compensation. We lost work vehicles, etc. So insurance companies did not make our life easy. And Angela shared before that her home has just been sorted now. I still have staff whose houses are not sorted. And insurance claims they're still battling for that. As a team, the resilience, like I have mentioned, we lent into that COVID. So if anything good came out of COVID, it was that just shown, and we already know that general practice is resilient, responsive. We can turn on a dime and respond, and that's what saved us. And people say in Gisborne we're gizzy hard. It's the first time I saw that we actually weren't. We were, it was quite soul destroying to see the impact a weather event had on people, having been my very first natural disaster I'd been through personally. After that, other little things that I could mention is we now have 4-wheel drives because our roads still get cut off now. Our road system and infrastructure here is still not up to par. Our connectivity still isn't great, I think. And I'm sure someone might correct me, but I'm pretty sure we have one cable that goes over all the Maungas to Napier, and that's our Wi-Fi internet cable. Starlink, Te Aotearoa kindly donated Starlink to all of us. We were able, like Angela, to get messages to our whānau who weren't in Gisborne, who couldn't get hold of any of us. It was scary for them. We were able to drive to the airport and you got 4 minutes, and then some businesses had Starlink and allowed me to go and do the payroll. Not that staff could get access to the money, but things like their mortgage payments, things like that, they all bounced, even though everyone knew that we did not have access to any form of internet banking or anything like that. So it's all those little things. And I think for me, the biggest thing is that impact on your team, upping around them afterwards, ensuring they're okay, ensuring they have the support, the pastoral care, not just from us, checking in with, Te Whataora here now have an amazing plan. We are prepared, and you have to be prepared from a business continuity point of view for those staff shortages for quite a long time afterwards. So I've probably missed a whole lot of stuff, but Angela took my thunder and basically said what I was going to say. But yeah, that's kind of mine in a nutshell. I'm happy to share lists we've created, shared our business continuity plan, which we're currently updating, but be prepared. Don't be blasé. Have those lists ready. Really take that continuity in your emergency response plans. And like Angela said, talk about it in all your governance monthly, just so it's on everyone's mind, because we've been lucky here to go for a while. Yes, we've had storms and, there's slash all over our beaches just from rain last week. But, preparedness is key. So.
Kia ora, Michelle. That's Goodness, and again, I've written quite a list in addition to Angela's list before. So there were certainly a number of gold nuggets amongst all of that. And I think you're quite right, the monetary side, both from a functional perspective, having funds on site, the impact on banking, mortgage payments, what they can do to add extra stress onto individuals on top of what they're dealing with for work and for their whānau. So but yeah, it's a good note to down here, transistor radios.
Yeah.
It's a good thing to have. Brilliant. Thanks so much, Michelle. So Martin, we've got you now, and I'm sure as you've been hearing Angela and Michelle, there are things going great. Yep, that's on the list of things that you want to share from your perspective. But over to you.
Yeah, look, thank you. Thanks, Michelle, and thanks, Angela, because lived experiences we cannot ignore, and the real gold is in what your experiences. And I talked to Angela the other day. I remember visiting Kaikoura probably 18 months after the earthquake, and staff were still having to meet checkpoints to go through the roading to get home. Some of them were an hour away, and they had curfews that they had to, and that's the life that they lived. It's not over within the following week or three. It's years and years afterwards, and so that's some of what you've got to get used to. Picking up on Michelle's point about the cash, in Gisborne area and Hawke's Bay, the EFTPOS machines were down because there was no power, and so you go to get groceries from or even where you could get anything, and you couldn't pay for it. So having cash for those sort of purposes are really important. The other thing that just want to stress around for general practice, your appointments are going to change almost instantly. You're going to have a lot more mental health appointments, and your appointment time. People are going to need more time, and so they're the sorts of things that you need to factor in straight away. Look, I've got a bit of a PowerPoint that I'm going to bring up just to sort of cover off some of those points, and just to really to emphasise some of the stuff. So resilience matters, and it really does. What I want to do is start off by sort of sharing a little bit about a quick overview of what happens in primary care and community healthcare providers in New Zealand. So commissioning, that's the arm of Health New Zealand that supports community and primary care. But I want to just acknowledge everyone in the room and the contribution that you're making. So, we've got a population of 5.3 million people. There's 19% of those live rurally. But there's only 94% are enrolled with general practice. So there's still 300,000 people out there who aren't enrolled with general practice. And we know the reasons for that, sometimes because they're not eligible, sometimes they choose not to. We talk about hospitals and the pressure on hospitals. Every day, 3,700 people attend ED across New Zealand. But on that same day, 50,000 people visit their GP. And that's primary care, that's general practice, that's you guys. Pharmacy, our colleagues in pharmacy, over 250,000 prescriptions are dispensed every day. Now, if you think today they closed because of a disaster across New Zealand, tomorrow they've got to do 500,000. It's just exponential. So that's the sort of pressure. There's $9.3 billion of funding supports primary and community provider services. And on the right, there's a list of, we've got 1,000 general practices and pharmacies and urgent care and ARC facilities. Everyone is contributing to keeping people out of the hospital system. And that's why it's important that we have a resilient primary care and community provider network. Look, 20 years ago, Hurricane Katrina over in the States, and one of the doctors at the charity hospital there said that the worst thing that happened during the whole experience was believing that their salvation was in someone else's responsibility. But they soon learnt that there was no white horse coming, there was no cavalry coming. They had to fend for themselves. And so as Angela and Michelle talked about, making sure you've got supplies, making sure you've got water, you've got cash and those sort of things. And incidentally, there's little tidbits that we can feed later, but things like don't store water in old used milk bottles because they can contaminate the water. And so it's little things about thinking like that. So, yeah, your salvation is in your hands during a major event. For those of you familiar with emergency management, they talk about the 4 R's being reduction, readiness, response, and recovery. That's down the bottom of this. But just the journey, before a disastrous event, we've got planning, our risk management, and what have you. Emergency response afterwards can sometimes be only 60 or 90 minutes for some events. And that's key period where you're actually checking that your staff, your residents, your patients, your fauna are safe, that your facilities are safe. What is the risk of deterioration? That's emergency response. Yep, it can take longer to get power and things back on running and flowing, and that starts to get your incident management. Business continuity is the sort of the longer drive that leads through to ultimately through to recovery. But all throughout that, operational resilience will help you address some of those elements there. Both Angela and Michelle talked about, and what I've last keyed is the three key investments: that staff, communication, and relationships. You know, if your strategy is that we'll go down to the local hire company to get a generator when we need it, how often do you renew that relationship with the hire company, so that when you turn up and there's 20 of you after the 12 generators, you know, how many of them are going to say, Martin, you come to the front of the queue because we've got your one ready? Or are you going to just be a stranger along with everyone else queuing? Communication. How do you communicate with your staff? Do staff know what to do if they're at home when the event happens? And ultimately, staff are your biggest asset. Including them in your plans, helping them to knowing how to, what their role is, knowing how to communicate with them, just so important. Look, and as a few take-home messages for you, you know, have your immediate response plans, your emergency plans, you know what they are. Do your staff know what they are? So that it's, or is this you just as a practice manager or the owner have written these and put them in the bottom drawer? Understand your critical functions, and critical functions are not only clinically focused. For example, payroll is a critical function, and so how long can you tolerate disruption for that critical function? What are alternatives? Have they been discussed and arranged? And I say and arranged because you don't just say, oh, if we have to evacuate, we're going to go down to the local community hall or the church hall or the school hall. Does the church, the school, or the community know that that's your plan? Do you have a key and those sorts of things? So do you understand what resource prioritization is? If you get a generator, and can it power the whole plant, or can it only really power up 2 computers, a couple of lights, and what have you? So knowing what your resource capability is will help you to prioritize. And ultimately, if you reduce risk, you will increase resilience. And if you increase resilience, you will take pressure off the hospital system. And that's my key message today to you. And look, encourage staff preparedness. Angela started off by this comment. And the more prepared your staff are at home with their own plans, with their own resources, with their own food stocks and what have you, the more likely they're going to say, you've got me for the next 2 days or 3 days. Otherwise, they may be racing off to feed the goat or the cat, and you've lost them. But if they're prepared at home, you've got them for longer. Sorry, I'm going backwards here. Plan beyond imagination. Again, this quote's over 20 years old, but you only need to think to last couple of months in Los Angeles fires. I don't think anyone in LA thought for a moment that the fires that would destroy thousands of homes and it would be so close to where they are was in their imagination. And so, and even in what happened in Disruptive and Hawke's Bay, that Michelle and her teams experienced, they never thought and planned within their imagination. And so that's the challenge for us, is how do we plan beyond imagination? I just want to really just finish up by sort of saying a glimpse into the future challenges that we have. You know, we've got a growing and diversifying population with changing demographics. So, for example, it's predicted that in 10 years' time, we'll have an additional 425,000 population spread across New Zealand. The population will be older, they'll be living in different locations. And so how is our planning taking that into account? The effects of climate change. We're seeing more more velocity, more regularity, greater impact. And again, the evidence is what Michelle has just talked about, the weather events. So we've seen more and more of those as that factored into our planning. We're going to hear more about space weather. I don't want to touch on that now, but that's something that's going to be impactful for us. There's a 30% chance that there will be a significant space weather event that could impact our power supply. Within the next 50 years, 30% chance. So it's something we need to start thinking about as we look at our future challenges. And the last one there is our challenges is beyond imagination. Really hard, but we need to be thinking of that, planning for that, and what have you. So I'm going to stop there and hand back to Coral for any open questions.
Beautiful. Thanks, Martin. Goodness, there's some pretty hard-hitting facts and figures in there, right? I particularly enjoyed the emergency management timeline and the impact of those different parts of the process when you're hit by an event. So just before, I've got a couple of questions that I want to share with the team, but just a reminder that we do have the chat or Q&A button available to put in for asking any of the panelists. So please do that whilst we are going to request a couple of questions for the group. Maybe, Martin, I'll just kick off with you if I can again, just in regards to, I think in terms of big picture scheming, I know being based in Aotearoa, Christchurch, and being part of Te Waipounamu, I know one of the things that's quite significant that has been bandied around in a few little places is around AF8, for if and when, or more like when, we have a major earthquake across the Southern Alps. So what planning is in place for those type of collective health activities in the time of disasters such as AF8?
Really good question, because I think that AF8 is, in my view, an underestimated event that we don't actually have effective, good planning. It fits within what we classify as a catastrophic event, and catastrophic is really where the whole system, and the system is not just health system, it's the whole community system, the way we live is just brought to a standstill for major parts of the region. So catastrophic event, there is planning going on from there with ambulance, with hospital system, with civil defence. So they've all got catastrophic plans. What I think there is opportunity for is to have more collective thinking, particularly from a community perspective, and saying actually what should be our ways of working when we've got a settlement and we might have 4 or 5 general practices in an area, and how can we work well? There's a chance that, for example, St. John may have to think their ways of working because roads are impassable. And so how do we manage that? And so do we have to go to a hub and spoke type model, or what do we? So huge opportunity to do more in this area. And I think that that's something I'll be certainly pushing in the next wee while. Just while I've got the microphone, one of the points I forgot to mention under relationships is, and Angela and Michelle both talked about building relationships with local councils, but particularly for rural areas, absolutely endorse that. But in more urban areas, really your relationships, keep building your relationships with your key stakeholders, like your PHOs, with Health New Zealand, because as the ultimate funder, because collectively we want to make sure that we work through any events together. But it's those relationships, even with your neighbouring practices, your neighbouring pharmacies, together we will get there. Thank you.
Awesome. Thanks, Martin. Another question, and this is open to all three of you, just to lean into. Obviously, this webinar is about saying, how do we build sector resilience? And so I'd be really keen to hear from each of you around how you support collaboration with others in your areas, and particularly around that point that Martin raised, that if one or more areas were cut off for whatever reason. May not necessarily be a natural event. It could be a massive fire or some other things outside of Mother Nature. And I know that there is some places that have localised memorandums of understanding, for instance, in the case of some impact to a region. So yeah, really keen to understand if there is something similar in place, either for Kaikoura or Gisborne, or that you're aware of, Martin.
I know there definitely is in Gisborne because of all our areas up the coast, leaning into Wairoa and then out to our rural regions. Iwi played a huge role there. So I know Te Whatu Order and our civil defence right across Tairāwhiti has that good plan, robust plan in place, has the right people connected, we're like the hub other than the hospital, so people aren't rushing to the hospital. Because of the size of my practice, we know this is the place that will be open. Easier for some of us townies to get in if there's no flood. The natural disaster, we wouldn't be able to get in if we flooded. But there are really good plans, and we have those resources as well as part of our emergency response. So we've printed those off, and Tairāwhiti, Te Whatu Order have and the PHO have shared those with us. We've shared our business continuity plans, and I know they're still working on all of those relationships as we speak, as we think of things that pop up from time to time. I think Pinnacle actually sent me something recently. I had to share my business continuity plan again. So I know we're tweaking and ensuring those relationships, connections, and the whole region is ready in case of being totally cut off like that again. Does that answer the question? I hope.
Oh, absolutely.
Yeah.
That's brilliant. Thank you. And Angela, you mentioned around, I guess, in terms of being in a rural, and some of the isolation issues around the Kaikoura and the top of the South Island there. You have quite connected relationships, haven't you, with other parts of the health sector, but also multi-sector across the entire community.
I think that's the benefit of rural and Gisborne's rural as well, is that we're small enough that we all know each other, and big enough that there's enough of us to support each other. And I think our emergency response group is kind of the first place within our community that we go where we talk about how we would manage things locally, because we're preparing for AF8. And in AF8, we will probably get no support as a community. Unlike when our earthquake happened, there was lots of support within hours, days, weeks. But in AF8, there won't be any support coming from within the South Island because everybody will be busy doing their own thing. So we're preparing for how we manage locally, and it's relationships with the local helicopter pilots. It's because we, like Michelle said, you've got communities. Post-earthquake, we had the Clarence community, which is part of Kaikoura, was completely isolated. The Aotearoa community was completely isolated. The only way for us to provide care to them was to fly a doctor, a nurse, and a wellbeing, a mental health person in to those communities to run clinics. And that was absolutely amazing and greeted by everybody with great relief, because they were feeling alone. And just having those people come in and having really experienced mental health support was just amazing. And so I think you connect within your community, but for urban, connections with other practices, as Martin said, really important that you have relationships with your neighbouring practices, and that you have checked that the Memorial Hall, I've got the key. I could have produced that I've got the key to the Memorial Hall. So if I need to remove patients from our hospital or rest home down there, I can. All those things that just help to be ready. And it's about knowing your community, knowing what's available, what's around, talking all the time to people about how you can help each other. And our local Māori health provider, all of the all of the local social services. Being connected to all of them for us has been really important and remains really important. We have a monthly networkers meeting, which is all our local NGO service providers, and those are the places where we make sure we all know what's going on with each other, and it just helps. You've got a relationship already with the local social worker from Te Whare Pūtea, so you know who to ring if you need someone to support a whānau. You've got a relationship with the food bank if you're worried about a whānau. You know, all those things are so important. So relationships are key. Yeah.
Beautiful.
Just to add to that, your marae are going to be strategic staging posts for any significant event, and they're well set up for feeding large quantities, for accommodating large quantities. So keeping relationships with local marae, your lions and Rotary groups, they're the people who can actually suddenly put 12 volunteers down to help you direct traffic or do whatever they need to do. Those, relationships.
Yeah, our Māori wardens were absolutely key.
Same.
In the event. And even and through COVID, you know, when we were running our COVID vaccination clinics, our Māori wardens were the people who brought people in, who supported us in the car park when we were vaccinating in the car park. You know, those connections are easily made for us as rural because we know each other a lot. Well, it's a lot easier for us in many ways, but if you're not in a small rural place, try and find people in your community, connect with your marae, your runanga, connect with your Māori wardens, lions. They're all amazing resources that you should make the most of, and they all want to help. Yeah.
And for us, it was the farming community, because what did we need the most? Machinery. And the diggers, the tractors. Like one of my staff members basically had to be brought out on a tractor that could get through the flood water to their house. And, you know, we had working bees with people with diggers going around that people's houses were covered in the mud from the flooding after the cyclone. So, yeah, all those connections. It might seem really silly now, but that was our saving grace. Ngāti Porou up the coast, they built their own roads because they knew the government wasn't getting around to it anytime soon. So they built, the farmers and the iwi got together and built their own road, cut their own road out in the hills so whānau from Aotearoa could get down to Tokomaru and things like that. So, yeah.
Yeah. So it's just amazingly important, isn't it? Those things. I wouldn't have got into town on the day after our earthquake if the local farmers, because my husband was away and I had young children, if our local farmers hadn't gone along the road and every crack in the road they had filled in with dirt from the banks, I wouldn't have got in. And even then, you know, one of those holes in a bridge that I showed you, a young fellow found that in the middle of the night when he was going to check on his parents in his car, and his car was upside down in that crack, you know. And so farmers filled those cracks in.
Brilliant. Oh, thank you for that. There's there's a couple of questions and comments I'm just going to go through before we start wrapping up. But yeah, it's a really good reminder, isn't it, that for preparedness, the importance of, as Martin said, relationships, and investing in that networking and connection, because that's where you're going to be leaning into when you really need them. So there's been a comment, thanks Sue, just in regards to, we touched on it a little bit earlier about sharing templates or checklists and whether we could have an ability to maybe collate that and send that out with a link to the summary of this webinar, and to have a link for those that want to watch this post event. So yeah, noting that there are some that templates are in place, but they're a little bit old, so an opportunity to do some really good continuous improvement and share that love amongst Aotearoa. Thank you. There is a comment here.
Coral, can I just chip in there?
Yes.
I'm really conscious that some templates are quite old, that are in use out there, particularly being used for foundation standard and things like that. So Health New Zealand is doing some work at the moment just to try and see if we can get something smarter. It won't be ready in the next 3 weeks, but it will come. What we can do is in the links send out a couple of links to some of the civil defence groups like the Wellington Regional Emergency group have got a really good, simple business continuity planning type response. But there's two elements too. It's getting the emergency response planning right, as well as the business continuity. So, yep, work going on templates, but it's going to be months rather than weeks away, unfortunately.
Nice. Thank you. Some comments around saying great presentation, so just sharing the love back. And Jane notes here, really brought to life the challenges we face and the incredible resilience of general practice. Love the message of the importance of relationships. Together we are stronger. Absolutely agree. Do you have any tips on developing those relationships? Anything more than what we have highlighted already? Anything else that pops to mind for the three of you? Covered it pretty well previously, I think.
I'd say one thing I'd say is make the most of opportunities in your community. So if you find out that you've got a community networkers meeting of any sort, go along. They really love hearing what health is doing, but also you learn a lot about what's going on in your community. The other thing I'd say is most of the councils have community relations or community support, or I can't think what ours is called, parts of the organisation. Connect with the person who's the manager of that team. They're great people to connect you into council if you're in the city. That you might not necessarily be connected into the council, but because you're in a bigger area, but it's a great way to make yourself known to them, and they'll be thinking about you in the event of an emergency if you have kept the connection going.
And actually understanding the connections your own team have in the community.
Right.
So I'm very lucky that I have a very large team that is well connected to volunteer fire brigade, someone with a helicopter, all the machinery. So yeah, as well as a community, have a look at your own team as part of your emergency response. What can you bring, or what can you do to help in those situations?
It's also the value add proposition. So, my experience is that a lot of people, councils and others, don't really understand what community providers do and the reach that they have and the impact that you have. And so sell yourselves up and sell up the fact that actually you're keeping people out of hospital, that you're doing the good mahi that you're doing. Christchurch earthquake, 6,500 people needed medical attention, and we know that from ACC claims. Less than 500 of them got it through the hospital system. So where did they go? They went to urgent care, they went to general practice, they went to pharmacy. And so that is an example of community care. And so sell yourselves up.
Love it. Brilliant. Well, goodness, look at that. We've done an hour and it just feels like we've touched the surface and there's so much more to explore. But I think, gosh, such a thought-provoking hour. And I really want to thank Michelle, Angela and Martin for that. Just incredible. I note there are a couple of other comments in the feed, and I have seen those. I think what would be really interesting is to be able to pull together some of those key messaging and share that out to the group after this event. And yeah, keep the wheels turning in regards to opportunities to connect and create the network of networks, right? Because we've all got networks, but then within that, those beautiful opportunities to really dig into what's available within your community. So to wrap up, as I said, thank you so much again to the three of you. It's been incredible. And to everyone that is online, or for those that are watching, we will be able to access a recording of this by the end of the week. We're hoping in the next 48 hours will be available to send out to the registrants. Otherwise, you'll be able to jump onto our website, which is www.colab.org.nz, and search for the webinar tab, and you'll find the recording in there. So yeah, before I close with karakia, again, wonderful opportunity to say thank you for the panelists today, rich conversation, and there'll be things that hopefully will take on board for everyone that's watching today and have those conversations with their networks. I wish all of you who are joining us live or watching this recording, thank you for your interest in this kaupapa, and take care. So I'll close this off now with karakia. Ko wānanga mātou, kia whakaria te tapu, kia wātia ai te ara, kia tūriki whakataha ai, kia tūriki whakataha ai, haumea hui e, pai ki e. Ka kite koutou.
Got it.